So thank you so much, Dr. Henderson. We really appreciate you taking some time today to come on and talk to us. As you are very aware, this is No Smoking Month, March, and we're here to promote women who can quit smoking in pregnancy. So I'm going to just let you introduce yourself today and tell us who you are and what you do within the Southern Trust.
Thanks very much, Gemma. My name is Nicola-Ann Henderson, and I am one of the consultants based in Craigavon Hospital. And part of my job is looking after high-risk mummies during their pregnancy.
Thank you so much, Dr. Henderson. So I just want to ask you, you see a lot of women with different additional support that's required within your role and within your professional opinion and your experience. Why do you think it's important that women quit smoking in pregnancy?
Well, quitting smoking is one of the best things that a mum can do to protect their baby, both during pregnancy and after they're born. So we know that smoking increases the risk of miscarriage, it increases the risk of stillbirth, it increases the risk of preterm birth, and it also increases the risk of sudden infant death in childhood. And having looked after mummies who have had to go through that devastating loss of a baby, I'm passionate about supporting mummies to do everything that they can to reduce the risk of this happening during their pregnancy. And stopping smoking is one of those things that a mum can do to help improve outcomes for their baby.
Thank you so much. I just want to ask you as well for our audience here today, do you think it's okay to vape in pregnancy?
Very little research on the safety of vaping in pregnancy, but the evidence would suggest that vaping during pregnancy is likely to be of significantly less risk than continuing to smoke. So if you have been vaping in an effort to stop smoking, then we would support you to continue doing this. But we wouldn't recommend vaping as an alternative to smoking. And we would encourage you to engage with our cessation midwives and nicotine replacement therapy, as opposed to starting to vape as an alternative.
Thank you so much for that. Also, just to ask you, do you think it's okay to smoke, particularly in the first trimester?
So smoking, the sooner you can stop smoking in pregnancy, the better it is going to be for your baby. So there have been studies done that have shown that if you can stop smoking in the early stages of pregnancy, so in the first trimester, that you can reduce your risks right down to that of a non-smoker. And we know that the longer that you continue to smoke, the higher the risk is likely to be. So the earlier you can stop smoking, ideally before pregnancy, the better that's going to be for your baby.
And lastly, Dr. Henderson, what advice would you give to mummies out there right now watching this who are maybe struggling to quit smoking and are worried about their baby? What advice would you give to them today?
Well, I would say delivering a healthy baby has to be one of the best motivators to stop smoking. I would say to our mummies, do make the most of the smoking cessation midwives and the support that they will offer you during your pregnancy. Make the most of nicotine replacement therapy if it is offered to you. And if your partner smokes, encourage them to quit too. Don't be disheartened if you're struggling. Not everybody quits the first time they try. And every day of pregnancy that you can maintain smoke-free is going to help your baby's health.
Thank you so much. That was so insightful, and we really appreciate your time and your busy schedule to come and talk to us today. And there's lots of support out
No
there, as you
problem.
say, for the mummies. And thank you for your time.